Hello everyone, this is the first topic video in this channel. This is going to be a bit interesting topic. I want to make a point about it. It includes from the dental anatomy or pediatric dentistry. This is a self-made note. In this I made a very concise important points to remember for the NEET exam, clinical knowledge, university exams, a chronology of human dentition. Let's recall from basics first year, the introduction, the development of tooth. In human dentition, there are two sets of teeth. The first one is primary, also known as deciduous teeth, and the second is permanent teeth, the succedaneous tooth. In primary, a total of 20 teeth. This you should already know. There is a different formula for different mammals like monkey, then cat, dogs. This formula is for the human dentition. The starting letter I indicates the tooth name. The I is for incisors and C is for the canine, and M is for molar. There is no premolar teeth in the primary or deciduous dentition. This horizontal line, the upper part is the maxillary jaw and the lower part is the mandibular jaw. So in a total of 4 incisors, 2 canine and 4 molars, okay, a total of 10 per side. If you take for 2 sides, it's equal to 20. Next we see about permanent or succedaneous teeth, a total of 32 teeth. This is the same dental formula but which includes premolar. So there will be 4 incisors, 2 canines, 4 premolar, and a total of 16 teeth per side. It comes to 16 into 2 equal to 32. This is a fact of an individual would have a total of 20 plus 32 is that 52 teeth in his entire life. There is no congenitally missing teeth. Next we see there are a precise lexicon for designating a specific tooth. The word lexicon means all the words and phrases used in a particular language, like terms or specific words which is used by a specific group of people. Dentists will use the terms more often. Example, primary human, maxillary, first molar. The one disadvantage of this long words or the long terms, these tags are lengthy and documenting details will be difficult. If you say every time a primary, a maxillary, a second molar, to overcome this problem, they created a tooth numbering systems. I will further discuss in the next video the tooth numbering systems. I should have said this earlier. The term etymology, basically a study of origin and history of words and their meanings. The etymology of teeth names all from Latin. Most of the dental or medical terms are from Latin and Greek. First word is incisors. It's from the Latin word incidere. It's meaning to cut into, to cut. The main function of incisor is to cut the food. Next, the canines. It's also called as cuspid. Like it has only one cusp, there will be one cusp. It's derived from the word canis, means a dog. The tooth, which is prominent, well developed in this family, it's most often refers to the dogs or this species Canidae. Like you can see a dog, there will be a sharp canine teeth. You can see in lions also you can see there will be sharp canines. Okay, but a lion belongs to the cat family. I come to the molars, then we go to the premolars. The molars are derived from the Latin word molaris, means millstone. This is a grinding stone. The purpose of the molars is to grind the food. Titrating ability is that grinding. Then we come to the premolars. It also known as bicuspid. It merely due to their position to the molars. Is that in front of the molars? It present if you take the molars. Okay, molars, and there will be here premolars will be there. It's called the term premolar. Okay, a pre-booking. Like it's like a premolar in front of the molars. We see a short overview of the formation of dentitions. There are 2 periods during the whole development of dentition, time stages. The first one is primary dentition period. The period is from the first tooth to erupt in the oral cavity of a child till the intact of all the primary teeth. All the 20 teeth will be present in the child. This period usually ranges from 6 months to 6 years. Okay, then the second period is called as a transition or mixed dentition period. It's an important MCQ. 6 years to 12 years. So the first permanent molar will erupt or the central incisor will erupt at the age of 6 to 7 years. So there begins a mixed dentition period. There is a mixture of deciduous and permanent teeth is present. Let's focus on primary teeth. The formation of primary teeth begins prenatally. Is that before birth at about 14 weeks or 3 to 4 months in utero. In the fetal life, tooth bud formation starts after completing of the first trimester. Is that 3 to 4 months, and completed postnatally about 3 years of age. Is that all the permanent tooth will be fully completed. The root will be fully formed at the age of 3 years. The first tooth in this dentition is that primary dentition to appear in the oral cavity is primary mandibular central incisor. I would have said earlier, the 6 months, the first tooth erupt is that 6 to 10 months of age. The last tooth to erupt in this dentition is that primary maxillary second molar. The mean age is around 28 months. A difference of 6 months of acceleration, early eruption or a delayed eruption is considered normal in primary dentition. I already said can be between 6 to 10 months. In this, there can be a time of 6 months. Okay, if a child is 1 year of age, there is no teeth in oral cavity. If the child is normal, it can be considered normal. There is no treatment required for that. Let's see the common pattern of eruption of primary teeth. This ABCDE is also used in designation of a particular tooth. Is that a tooth numbering system? I will discuss later. You just remember the A for central, B for lateral, C for canine, D for first molar, E for second molar in the primary dentition. The first tooth to erupt in the maxillary arch, central incisor, followed by lateral incisors. Then, before the eruption of canine, there comes the first molar. Then the canine will erupt. Then the second molar will erupt. As I already said, the last tooth to erupt in the primary dentition is maxillary second molar. The same way in the mandible, central, lateral, first molar, canine and second molar. Let's compare the pattern of a tooth eruption. The first tooth to erupt is mandibular central, followed by maxillary central, then maxillary lateral, mandibular lateral. This two tooth have a similar time of eruption. The first molars, then the maxillary canine, then the mandibular canine, then the mandibular second molar, then the maxillary second molar. You remember this? Like if you draw here, then you do this. This is the pattern. This is additional thing to know. Differentiating a child based on their age. This classification is given by National Institute of Child Health and Human Development. This was given in 2015. First is the neonates, or the newborn babies from the 0 day to 27th day. It's termed as neonates. Then the infants. Infants is the birth after the 28 days to 12 months. Then the toddlers from the 1 year to 2 years of age. Early childhood 2 to 5. Middle childhood 6 to 11. Early adolescence 12 to 18. And late adolescence 19 to 21. These are the classifications of the age based on the pediatric patient. If you see a toddler comes to a clinic, in the sense means the toddler at the age of 1 to 2 years. A patient comes at the early childhood age. They will not mention the age. So the early childhood age is at 2 to 5 years. This is somewhat additional points. Mostly they know, they won't ask in that way. Next, see, this is the actual chronology table. This was taken from a textbook of Wheelers. I will quickly explain these terms. Let's see the dentition they given, primary upper and primary lower. These are the tooth. Then the first evidence of calcification. The tooth bud will form a shape. It will attain the shape. It will be get a calcium. In primary, it all happens in utero. Okay, is that in fetal life? The given weeks. Then crown completed. This is the time of the crown completion before it get erupted into the oral cavity. This is given in months. Then the tooth eruption given in months. Then there is values given in brackets. These are the mean values. You should remember these values. Okay. The starting stage will be like this. This is the first evidence of calcification. Then the entire crown will be completed. Okay. Then the tooth comes above the oral cavity with a bit of root formation. Like this, a bit of root will be completed. Not fully the root is completed. Then the root completion. Then this is the time where the complete root will be present. Like if you take this incisor, complete root will be present for the primary tooth. You should be familiar with this table. This given in textbook of Wheelers. Next we move on to the textbook of pediatric dentistry. They given the average values. Table will be simple to remember. The same only given there, but they calculated the means and given the mean values of 6 months. I said no, 6 months, 8 months, 7 months, 2 months. Only 2 months of difference will be there mostly. The second molars might have a difference of 2 to 4 months. If you remember the tooth eruption sequence, you can easily start calculating the months. I will give an example from the previous pattern. So you can easily remember from this pattern. 6, 8, okay. In this table they given 7, let's be 7. So the maxillary will be around later plus 2, 9. Canine given for 16, comes to 18. Then the second molars 20, 24. Like this you can easily remember the first tooth erupt and the sequence of pattern. It will be so easy to remember, and the tooth eruption ages also you can easily remember. The root completion usually takes around 1 to 1.5 years, okay, to get a complete root formation after the tooth eruption. If you take 24 months, is that 2 years plus 1 year equal to 3 years. The root completes at the 3 years, okay. This image you would have seen in the textbook of Wheelers. This image is so important. There might be questions in the NEET MCQ based exams and gives a basic understanding of the tooth eruption. This box, this is the before birth, in the fetal life. The same thing it's being repeated in a pictorial way. The images are representing the stages of tooth is given clearly at the age and before birth, 5 months in utero. This is 7 months in utero. You can see there is 4 tooth buds at the age of 5 months. 1, 2, 3, 4. Okay. Similarly, if you take in 7 months, you can see the 5 tooth buds. 1, 2, 3, 4, and 5. Okay. At the time of birth, you can see clearly the tooth buds. Okay, 1, 2, 3, 4, and 5. 5 tooth buds you can see clearly. Similarly, after at the 6 months of age, I said now the first tooth to erupt is the central incisors. You can see central incisors being this is the central incisor, lateral incisor, canine, first molar, second molar. Similarly, central lateral canine, first molar, second molar. This white color is given as the permanent tooth. The permanent tooth bud is started to forming. Mostly the incisor would have come out in the 9 months of age. If you take 1 year, instead of 12 months, molar might come. This cannot be standard. Okay, there will be difference. There will be a difference in mean values. But you should be remembering this. This is during the infant. I said no. The period of 1 year is known as infancy. From 2, okay, from 2, 3, 4, 5, 6 years till they given. Okay, if you see 2 years of age, mostly all the tooth would be erupted. Okay, all the primary tooth would be erupted, and the root completions still left. At the 3 years of age, all the primary tooth would be completed. Then comes the period of known as acquisition period, 3 to 4 years, where the primary dentition plays a major role from the age of 4 to age of 6. Then it goes to the mixed dentition period. This is known as early childhood or preschool age. This values, the mean values might change in the textbook of pediatric dentistry. The same images will be given. You should get a fair idea of this images to understand the tooth eruption sequence. I will say later why. Okay guys, this is all about the chronology of human dentition. In particular, I said about the primary dentition. Then we can continue the mixed and permanent dentition in the another video. Please make sure to like and subscribe. To make the notes and to make the video takes a lot of time. Let's end this video by solving few MCQ questions. This is a very important question in NEET MDS examination. Might be asked in INICET too. The first question: a child comes to the OPD with their parents complaints of no teeth in the mouth. The child was about 10 months of age. What will the clinician will suggest? Okay, the child is having normal growth. If they not mention, so it is a normal growth situation. If they mention the child have a developmental delay, then the answers, the options might change, and the answer will be changed. First option: take a radiograph and assess the tooth stage. Advise the parents this could be normal or this is normal. Assess the child nutrition stages. It can be done. Provide surgical treatment. Now, if you go back to the video, you see a difference of 6 months. Okay, acceleration is that early eruption or delayed eruption is considered a normal in a primary dentition. If you consider this is normal and there is no problem, the answer for this would be advise parents this could be normal or this is normal. Okay, it's only 10 months. Still we can wait for 2 to 3 months. Then we can take a radiograph and assess actually a tooth birth is present or not. Next question: what is the eruption pattern of a primary dentition? I said in the above. You try to find the answer. When is the mixed dentition period? It's also clearly said in above. You can easily solve this. Okay, this is what I'm saying. You should be familiar with these images. This will be asked in the exams. Identify the age of the child. They will be giving options. Okay, identifying based on the teeth present. All the root are completely formed. Then started to resolving the root of the molars. You can see. Then this also completely root erupted. This is also going to start the root resorption. To calculate the dental age, you have to see the primary tooth or in contact. So the age should be above 3 years. 3 years of age, all the roots will be completed. If you see further, there is also a root resorption. The permanent tooth start to apply pressure, then the root started resorbing. There will be age of 4 years if you take, because the central incisors are being resorbed till the middle third. And another key point is that you can also assess the second molar, the permanent second molar calcification status. It will be clearly depicted in the image. If you see the image a few times, you will get an idea. So in this image, the minimum can be 3 years. The maximum can be, I would say, around 4 to 5. I would say. If you see the options 4 to 5 years in the above the values, the mean values. Okay, so I'll change the option to 7. Okay, between the 4 to 5 years, the corresponding answer will be 4 years. 4 years. Plus or minus 9 months. This question is frequently asked in the NEET MDS examination. Calculate the dental age of the child. The first thing you should check for the maximum age. You can clearly see first permanent molar. This is also the first permanent molar. It's still not come into the oral cavity. So the age is not above 6 years. So then you can easily cut out this option. A tooth bud it started to calcifying. This can't be a 3 years of age. Then comes the option 5, 6. If you see, there will be a primary tooth. There would have been a primary tooth. Okay, it started shedding, but it's not. It can be early shedding of the tooth. At this level, okay, the second molar. So you come to the option as I would say the age of 5 is the option, because you can see clearly the permanent molar is not erupted. So it's not 6. The actual age will be 5. The age of the child can be 4 to 5 years. Now the best option would be 5 years. There can be a difference between a dental age and the actual patient age. All this value have a mean. Okay, so this can be standard. If you say 6 years, the molar should be erupted. No, it won't happen in all the children. There might be few early eruption, few can be a delayed eruption. So in the upcoming parts, I will explain the mixed dentition and the permanent dentition and the questions asked in that. If you find this video so interesting, if you want more content or class like this, please make sure to subscribe to the channel and give a like button. Thanks for watching. Bye bye.